because there are more and more people in India who are choosing to get rhinoplasties done. There are more and more people across in this huge country that are performing rhinoplasties, and so a lot of the patients are not very happy. So it's a very fine surgery. So I think before you decide to go to the rhinoplasty surgeon, you have to really choose to go to the person who's got good experience, lots of patients to show you before after results. Anyone can do a morphed image and say, look, this is how you are, I'm going to make you like this. Software is different, handwork is different. So I think these are the factors that you have to consider before you go and get a nose job done in the first place. Now, having said all of this, I'm going to get to this very important point. Some patients do ask me whether my patients also go for redos. Now, answer is yes. I have to be honest. It is yes, because if I do 100 patients, and I think in the last audit we found that about 5% of the patients might want to get some kind of redo done. Why is it around 5%? Well, because sometimes we're not able to get exactly what the patient desires. Sometimes it's done a little bit more. Sometimes patient has a small bump after surgery, and that can cause a deviation in the tip. Once in a while, that's also a factor, because you know what? You have to understand that the nasal bone fracture, nose trauma, is the most common trauma of the human body. And therefore, post-rhinoplasty, post-nose job, there is a 4 or 6 week period where you really have to be careful, no matter who does the surgery. And in this window, a lot of patients can do things by mistake, or can happen that the nose goes through something that then